Hi, everyone. It's Dr. Susan here with the home edition of Your Voice with Dr. Susan. Hi, it's Dr. Susan, and I am so glad that you are with us on the Ask Dr. Susan. We have a very special session tonight. We're doing it on a different day, and we're welcoming Dr. Bruce Y. Lee. How are you tonight, Bruce?
I'm good, Susan. Thanks for having me.
I'm so excited to have you on tonight because wait till you hear what Bruce's credentials are. For those of you that know him, that's why you're here. And for those of you that don't know him, Bruce is a writer, a journalist, a digital and computational health expert. He's a system modeler. He's a professor and entrepreneur. He's a professor at CUNY, and he's also a director of the public health systems there. And he's also a regular writer, as I mentioned before, but he's a regular writer for Forbes. And Bruce, what I also want to share is I know a little bit about your mission, and your mission is, quote, to help everyone better understand the complex systems of health and science. Well, I don't think, at least in my lifetime, there is no time where we have needed you more in terms of you have the opportunity to fill your mission, right? In terms of what's going on right now. So I think we can all agree on that. So what I'd like to start is you get so many questions and you've written about so many topics right now with COVID-19. So what are you finding is the most challenging? And then I'm going to ask you some specific questions.
Mm-hmm. Well, one of the most challenging things is there's just so much information that's floating out there on social media, on the internet, or just talking to people. And it's tough for people to sort out right from wrong. Right. Because there's just so many voices out there. And one of the challenging things is that when you have a common enemy, which basically this pathogen is, this virus is a common enemy that's really spreading throughout so many different countries, not just this country, but other countries as well, it really requires a coordinated response. When you have an emergency, you can't be in a situation where, like, if a building's burning down, you can't be arguing with people. And you can't be saying, okay, is this really serious? Or, maybe this fire is a hoax, or, who caused this fire? All these voices, you really have to kind of get together and say, okay, how do we get ourselves out of this situation? And how do we tackle this common enemy? And when I say common, it's not just within this country, it's across the world. Like, how does the world work together to deal with this common enemy? And I think that's the biggest challenge, because it really requires that, because this is a very complex virus and it's causing a lot of complex problems. So if the response is very disjointed and uncoordinated, we're not going to be very effective at controlling the virus.
Right. And we know that, at least it's my experience, and it's not happening right now, right? And we see a lot of contradictory information. And I think maybe let's start there, because I even know for myself, and I pride myself on being a pretty good consumer of media and have some media intelligence and knowing how to navigate. And even I'm confused about who do I believe? What do I read? What sources are the best? So what are you finding, given that there's so much disagreement? How should, including myself, how should people navigate through all of the information and know who to trust and know where to go for reliable information?
Mm-hmm. So that's another big challenge with this current pandemic. A lot of these things that are happening are not surprises. So there's a whole community of scientists and public health experts who, over the past couple decades, and I'm part of the community, have been studying things like this. So, and then this is not the first time that we've had an infectious disease outbreak or epidemic. So we had a pandemic back in 2009. We've had the Zika outbreak. We've had the Ebola outbreak. There's a SARS outbreak back in 2002. And there are always these different infectious diseases that you may or may not hear about that are acting up and going up and down in terms of activity. So there's this whole body of science on how to deal with an epidemic or pandemic. And so one of the keys with this pandemic was, how can we execute or implement the knowledge that we already have. And the contradictory information that people are hearing is not from that community. It's not from the scientific community that studied these things for years and that, figured out things by trials, by studies, experiments, etc. It's coming from all these other sources, which I think is making things very confusing for people. You'll see during this pandemic, suddenly everyone has an opinion. You jump on social media and so, you have people in big caps saying, this is such and such, or throwing out some statistics. And you have to ask yourself, okay, wait, how long has this person really looked at this? Is this really scientific evidence? Or is this someone who just decided to say something? And a large percentage of the voices out there are people who just decided to say something. And there's even talk about, is there misinformation being really pushed? There's talk about bots pushing information. And then there's a lot of political agendas that are out there, a lot of financial and business agendas. And that's the problem. Like, you ultimately have to stick to the science. The science has been relatively clear. There's been a few things where scientists have had to wait because this virus is a new virus. So you have to actually see how it behaves and figure out what's, the specific of what's going on. But the strategy hasn't really changed that much. So I think one of the key things is to really look at, where is the information coming from? What type of scientific evidence is behind it? I'm sorry, go ahead, Susan.
No, I just want to underscore point number one, because I think you're saying the first thing for people to do is to question, who is the information coming from? How long has this person been in the position in terms of knowing the information and sharing the information? Because I think that's a really good point that we forget about, because when we see somebody that we might respect in one area, in this country, I think, and probably worldwide, I don't know, but when we have like a mentor or somebody that we look up to, we think everything then that they say is correct. And I think that especially now, that's so important that you can admire the person. They could be really expert at some things, but when it comes to science and the information about the history of pandemics, and that is true, and I want to underscore what you said, is to say, okay, how long has this person been in that arena, right? How long has that person been involved either in the actual field of science or has been reporting on science and being in that? So I wanted to just underscore, because I think that was, that's not talked about enough. And I think that, a lot, and I see it happening where, again, where people who might be admired for lots of different things are now looked to for certain information that's contradicting what the people who are really in it and have the expertise in it are saying. So to continue, so I would say that's number one. If we were looking for real guidance and tips on how do I know what information to trust, the first thing is who's saying it and where are they getting it from?
Yep. And I think it also, you have to look at, what type of information is being provided. So it's one thing to, criticize or blame something or say, okay, this person's wrong, but like, what are you providing solutions, and are you providing evidence behind your proposed solutions? Some of these things are fairly straightforward. Like, for instance, it's a virus, and the virus spreads from person to person. So if someone's saying, well, don't use separation in terms of physical distancing and social distancing, and when we say social distancing, we don't mean cut off communication with people. We mean try to keep distance. And if someone's saying, oh, no, we don't do that, well, it's still a virus, and it still will spread if there's physical contact. So unless you can provide an alternative to that, you have to go with that intervention. So really checking to see if people are walking you through the explanation and saying, this is the recommendation, or this is what needs to be done for these reasons. Here are the limitations, because I'm going to be very frank in terms of the limitations, but we still feel that you should do this based on this reason. And if you look, the people that have been studying this for a while, they'll say that, they'll say the limitations of what they're suggesting. Whereas some loud voices, you'll see, lots of exclamation marks, all caps, but there's no real acknowledgement that, okay, here's the limitations of what I'm saying, and this is why this is the rationale behind what we're explaining or what we're saying.
And I think what happens is, and we were talking about this the other night, there's, what we call confirmation bias, and people want to hear what they want to hear because, we want to be able to be physically together. And you know this, that I like to use the term physical distance as opposed to social, because socially it has a different thing, but we can leave that aside. But if we're talking about physical distance, nobody wants to be physical. It's like, okay, it's 10 weeks already, we're done, I'm ready to be physically close. And so when we hear someone saying, you and someone that we respect, right? It's okay. It looks like it's now okay to be together again. We want to hear that, I think the other piece is, being aware of, what's your preconceived desire and notion, and then are you going to be open? And it's not about being political. And I just want to say, I'm not looking at, it's not about a political orientation, and it's not about who's right or wrong. It's about the facts, right? But
absolutely.
If we're putting the facts out differently, we have to be careful about, well, what if, it's almost like, what if that was right, that you did need to distance? Would you accept that? And for a lot of people right now, it's like, maybe the answer is no. And that's why people are listening to the contrary, or some people are so easy to just say okay to the non-science explanations or recommendations, because it's really hard to accept that you can't have people come into your home, perhaps,
Absolutely. Yes. Yeah, there has to be an understanding that, we're in a different situation. Things have changed. And so there needs to be a solution. And we have a problem, so there needs to be a solution. And the solution isn't just ignore the problem. There has to be some way of preventing this virus from spreading. And it's a real virus. So you're absolutely right that there can be this tendency to say, okay, I want things to return to normal as quickly as possible. And many people would like that. This is by no means easy. The situation is challenging. But the fact is that, we as a country have faced other challenging situations in the past. Maybe people weren't around back then when there were other types of challenges, but fortunately and unfortunately, challenges such as infectious disease outbreaks are a fact of life. They're going to occur. One of the key things, the key points is that over the past 15 years or so, it's been repeated over and over again from the community that it's not about if the next pandemic occurs, it's when. This will not be the last pandemic. We're gonna see other pandemics in the future, and this certainly will not be the last infectious disease outbreak. So that's what happens. Over time, these things happen. That's the biology, that's the epidemiology of these different
Bruce, just go back. When you say for the community, just clarify that, because I know what you mean, but I want you to clarify that, because you're talking about the community that has been involved for years. So can you talk about that community a little bit and then continue? Because it was a little...
So that includes people, it includes a wide variety of folks. It includes people who are scientists who are studying these different types of pathogens in the laboratory. It includes scientists who are studying these pathogens in the field. And it includes people who are studying pathogens amongst humans and also animals. It includes public health officials, public health experts. It includes folks who are philanthropists, who are interested, folks like Bill Gates, who have contributed funds and supported a lot of this research. It's been very, very clear that these events in which viruses and different pathogens jump from animals to humans, and sometimes that'll occur and it's no big deal, but everyone gets a little bit concerned and they say, okay, we're fine. But then sometimes it happens and people get more concerned. And of course, there are situations like this where it becomes an even bigger problem. So this community, this pandemic, epidemic preparedness community, and also includes security experts because, you know, they and operations experts who have to help respond to a pandemic or epidemic, have predicted that this would happen, again, when it happens and not if it happens. And so that was the big question, you know, when is it going to happen? And there's been warnings. And the challenge is there hasn't been enough concern and enough support of being more prepared. So there was a lot of concern amongst this community, this preparedness community, because we're all very worried, like, okay, we can't keep waiting another year passed and nothing happened. Okay, so it's really a different perspective. Whereas if you look at, you know, the general public, maybe there wasn't this awareness. So this seems like a surprise. The virus comes and everyone's surprised. But where if you're been looking at this for the past decade or two, then this is not surprising. You just didn't know the exact timing and where it specifically will come from.
So why do you think that we weren't more open to that? Was it because of the timing and not knowing, or is it partly not wanting to know, not wanting to face difficult things? What do you think when you think about this? And I know you do a lot of thinking about this in many of your roles. What do you think?
Well, part of it is human nature. So human nature is to not deal with a problem until you're hit with it in the face. And so, you know, we always give the example of, okay, you know, you don't think about your health until you get chest pain, which lands you in the emergency room, or you get very sick. You're like, oh my goodness, I better start eating better, or I better start exercising. So that's sort of the teachable moment when you realize, oh my goodness, I need to take better care of myself. And we all do this. Okay, we're all in this situation where, you know, we push aside some type of preventative measure, whether it's a health measure, or maybe it's, you know, even like cleaning out the attic, or making sure you keep in touch with family and friends. Like all these different types of things we'll tend to neglect, because there's a whole tyranny of the quote unquote tyranny of the urgent, where you're more likely to address things which are more urgent. So we run throughout life addressing things that are more urgent. So really preparing for something is more of an investment. And it's hard from a human nature standpoint to do that. The second issue is it requires investment. It requires resources. So you have to convince people, like, you need to sink some money into creating infrastructure or creating a surveillance program that will look for these different types of viruses. And whereas people are arguing to put money elsewhere. And so you're really competing against a lot of different voices and saying, no, don't put that money here, put it over here. And so it's a tougher argument. It's the same challenge that you face with vaccines, because vaccines are supposed to prevent something, and it doesn't take care of an immediate problem right then and there. So you don't see that problem. So sometimes it's tougher to invest in something.
Yeah. And I think you're right in terms of, we all experience that, right? You know, you might have a tooth that's kind of, you know, causing a little bit of discomfort, or it's cracked and you know you have to get to it. But as soon as it causes a lot of pain, or it falls out and it's clear, so something's not a problem until it's a huge problem in a sense.
Absolutely. Yeah. And the other issue is it can seem a little removed. Like when people are talking about these infectious diseases, you know, how many people regularly go to the NIH website, for instance, just for leisure reading? You know, maybe some do. There's certain people in the scientific community that's leisure reading, and that's fun. But you know, many people won't do that. Or you know, you hear about a certain virus that's maybe in bats or some other animal, and you think, well, that's not really so relevant to my daily life or what I'm doing. But that's where these things come. So it's a complex system. So it's a set of different steps that occur. And again, as humans, we can find it challenging to think more than one or two steps ahead. For instance, you know, if someone pushes you, you're like, okay, that person pushed me, but you don't look at like maybe 2 or 3 steps and like this could lead to this, which could lead to this. And that's what happens. There's a chain reaction, and eventually something like this occurs.
Okay, so now that we're here, right? You know, that's a little bit about what we can do, and maybe hopefully we'll apply it to the future. But we're still in it right now. And you know, the other thing that I was thinking as you were talking about the whole, it's not a problem until it's a problem, is the experience that so many are having in terms of different experiences, right? we have people from all over the country on this call, and depending on where you are, you can even be in the same borough and have in the city and have different experiences in terms of what people should be doing and what the norm is and what behavior is. So what do you, I know that you've done a lot of writing about that and thinking about that. What's your current thoughts on how that's affecting different people?
Yeah, so I think that we can look at it both sides. So this pandemic certainly is differentially affecting different people and different populations and different social demographics. So you may have seen the news showing that there are some of the social demographics that are getting harder hit by this pandemic. And the main reason for that is when viruses spread, they mirror what's actually going on in society. Because for a virus, in order to spread, you have to have some type of contact with someone, either direct physical contact or maybe through, coughing or respiratory droplets, or you touch the same thing. So you see situations where, a person's type of work and their social structures and their interactions will determine their risk for catching the virus. So certainly people who are essential workers, who still have to continue to go to work and can't just cut themselves off from other folks, are at higher risk. Healthcare workers and people who are maintaining a lot of the businesses that we all depend on. I mean, that's why they're essential. We need them. So, but that puts them at greater risk. And then social distancing may be easier for some. Certainly, if you have a house and you can stay in the house, that's okay. But there are many people that don't have that luxury. They go back and they live in a very crowded neighborhood, or they have to go to work because it depends. Their paycheck depends on that. And then also, we saw in New York City. New York City has a denser population. There are more interactions. So what you're really seeing is a heterogeneous effect, and the virus itself doesn't discriminate. The virus doesn't say, oh, I'm going to go after that person and not that person. The virus just basically relies on contact. But what you're seeing is a lot of these disparities and differences in people's situations being uncovered by the virus, so there's definitely that differential effect. So that's on the one side. So you're actually seeing the virus spread heterogeneously. On the flip side, you see very different reactions amongst folks, and that's for a variety of reasons. So one is, you mentioned previously, there's all sorts of information out there. So different people are listening to different things, and as you mentioned, confirmation bias is there. So people originally go in initially with their biases, and they just look for information that will support that. So you see people handling the pandemic very differently. Also, there's communications issues, and not everyone is being reached. And also, we have to keep in mind that people have different trust levels with different people who are communicating information. If you see someone that looks like you, that can relate to you, you're more likely to listen to that person. If you see someone that you feel like, oh, that person can't relate to me, that person doesn't understand my situation, you may be less likely to listen to that person. So we're dealing with all these different forces, and that's why you go out and you see people handling things very differently. And of course, psychologically, there are people who are more or less accepting of what they're hearing or the situation, or they may be more willing to adapt to different situations. So it's very complex.
Yeah, and another piece that was brought up last week by Joel was this notion of the sleeper effect, right? That people hear of something and that kind of stays, but they don't know where they got it from.
Yeah.
And so once a piece of information kind of catches on, it's like that it could be a piece of misinformation, but you forget even where you heard it, And it's like if you ask somebody, well, really, where did you hear that from? They might not know.
Absolutely, yeah. So I mean, there are all these behavioral and psychological challenges in a situation where you're trying to process information,
Right.
and we hear about all these heuristic biases as well, right? You're more likely to hear something that's more salient. You're more likely to listen to something that's maybe more recent or maybe earlier on in the situation. So everyone has their own biases, so you have to remember, and you actually have to make an effort to try to say, nope, okay, let's just recognize your own biases, recognize what you're more susceptible to when it comes to taking in information, and then put that aside on the table and say, okay, I want to be open and I want to evaluate things for its own merit. And that requires extra effort, and it's especially challenging when it's an emergency.
I know that a lot of people have specific questions, which we'll get to, the everyday, like, can I reuse a mask and all that. We're going to get to that, but I just want to ask a couple of other questions. One of the things that I'm finding is people aren't trusting even reliable sources or historically reliable sources, because it sounds like the recommendation rather is changing. I remember when the first week before New York and we even shut down, that, the CDC came out and said, you don't need to wear a mask. Then the next week, you need to wear a mask. And then it becomes, well, it's not protecting you, it's only protecting the other person. And now it might be protecting you. And so what happens is when you have, and another thing that happened recently is a change on the medication to use, right? So for a long time, the research was saying, and the CDC was saying, this is not recommended. And then suddenly, because certain leaders were using the medication, it then softened the recommendations, right? And then it became, no, just check it with your doctor. So how do you even continue to trust those institutions that we are supposed to trust when they're constantly changing?
Yeah, I think with those two examples that you mentioned, so the mask issue has been interesting because certainly on the surface, it looks like things have changed back and forth. But this is an example where the messaging wasn't clear, and it also was not, it was muddled by other information. So the mask recommendation hasn't really changed that much. So it's always been the situation where, so you have several different masks. So you have the N95 masks, and these are masks which basically healthcare workers, you see healthcare workers wear them, and they're supposed to filter out the virus. They're called N95 because at its worst, like if you were to graph the size of the particles, some particles are easier to filter out, like big ones. So, naturally, if like something like a football comes after you, it's going to, block it or what have you, or something very small. But like you run into challenges between 0.1, 0.3 microns. But even that, it filters out at least 95%. That's why it's called an N95 mask. So those are supposed to protect you and potentially protect other people. Those are the things very early on, the CDC and other folks said, don't wear these, if you're just in the public and you're not a healthcare worker, don't wear these. And the reason for that recommendation was that, number one, there's a shortage of masks. And two is, to wear those masks, you have to be fit. They actually have to fit you. And there are all these guidelines, like those masks become less effective over time. You're actually not supposed to wear them more than 3 to 5 times. And so the concern was that people would be using these and when it was in short supply, but also they'd be using them improperly. If you actually use them improperly, you can infect yourself because it's a filter.
The N95, the true N95,
yes,
initially was don't use it because there's a shortage, but the N95 is used with healthcare workers, and that is the mask that, if worn correctly, can protect the wearer from both. It protects the wearer and others, correct?
Exactly. Yep. Exactly. So that's the reason why people said, don't wear these masks. They specifically were talking about the N95. And then with the other masks, people were saying, if you're trying to protect yourself, they're not going to be useful. Like the surgical masks, the ones that aren't in the N95 or bandana and those things, like it's not going to protect you. That hasn't changed because the virus particles are too small and they're going to be able to get through the holes.
Why, if we're so concerned about the spread, why not increase the manufacturing of N95s for everyone.
That was an issue. People were saying, well, why not massively increase the supply? And that was the push for the federal government to enact the Defense Production Act and say, okay, produce, but for a variety of reasons that didn't happen. The other problem is that it is hard to ramp up so quickly because if there weren't even enough masks for healthcare workers. Imagine trying to cover the entire population. So they did try to ramp up. You're right. I mean, if enough people in the population had those masks and were trained properly on how to use them, then that would be even better. But that just wasn't the situation, and that still isn't the situation. So that recommendation has not changed. And the fact that wearing the other types of masks doesn't protect you, that hasn't changed. The only thing that has changed is saying, okay, people have said you can always cover your face if you want to, but now it's being recommended or suggested. And the reason for that change is studies have found that the virus appears to be more contagious than people realize. In other words, the spray through the air is more significant, and that took time to figure out. So that required studies. So the initial assumption was that this virus is going to be similar to other respiratory viruses like the flu and other types of coronaviruses, but this virus is turning out to be different. So that's the one thing that's evolved, but it's not a massive change. It's just now it's being encouraged because they realize, okay, well, if you're just breathing out the virus droplets, it's probably better to cover your face so that you can protect other people. So that's the one thing that's evolved.
And then with the medication, with the hydrochloroquine, that seems to have in the last week changed slightly. That prior it was, from my understanding, and please clarify this, is that it was in being researched and being studied to see if it could be used as a cure. Then it was talked about as a preventive measure, and from what I understood, it was not to be used as preventive, and that what they found in a lot of the studies was that it actually could be hurtful and have some unwanted consequences. And then the study said, don't use it even as a cure or to slow down. But then we had certain people that are using it that are in leadership positions who that came out. And then I noticed that on the CDC website, it kind of shifted this week to, it used to be the recommendation, and please, you clarify this, the recommendation was to not use it, and now it's check with your doctor. That your individual physician should be the one to be making those recommendations for you. So what's the truth on that? Break on that. Yeah, please.
So this is an unfortunate situation where a lot of this has been politicized, and from a scientific standpoint, so those who are in the scientific community haven't really changed their opinion of this. So what happened was there were some initial case studies. So if you recall, early on in the pandemic, different people were trying different things because this was a completely new pathogen. And so you would have researchers and doctors just trying different medications to see if it would have an effect. And then there were some case reports that came out of France that suggested that it could reduce the length of illness, the duration of symptoms and things like that. But when that first came out, the majority of the scientific community said, okay, these are case reports, okay? And when case reports come out, like, you don't know what else happened, because case reports aren't formal clinical studies. They don't control the studies with placebos and make sure everything's matched up. It's just you get a bunch of people and they happen to get the medication, and it seems like some of them happen to have shorter lengths of illnesses. So, but we don't know what could have caused that. So if you look at the chatter in the scientific community, most folks said, okay, this doesn't mean anything, but it's worthwhile continuing to study it. But the trouble is, once that came out, you suddenly got all this noise saying that, this may be a treatment. And that was very premature. It was fairly irresponsible to say from that data that this is a potential treatment. So if you paid attention, if if people paid attention to the folks that were in the know, to my knowledge, none of them said, "Oh, this is a treatment." The key was trying to like control that chatter that was saying all these other things and really confusing the general public. The same thing is true with it being a preventive measure. That never came out of the scientific community that it should be a preventive measure. That's actually one of the reasons why the NIH established a website called the COVID-19 treatment guidelines. So if you Google it and make sure it's the NIH website, nih.gov, what they did was they pulled together a number of scientific experts who revealed evidence, and they're updating that regularly. So it's a live document. And that's where you can see, is there evidence behind each of these different treatments? So if you really want to figure out what's going on, go there, because it lists all the experts, so you can clearly see who the experts are. At no point did they say, "Oh, this might be, there's evidence that this is a treatment or a preventive measure." That has not changed. So again, that's an example of where the scientists have been fairly consistent, but it's really this other noise that's really made things confusing for the public, I think.
Thanks for clarifying that and giving us that site to really look at. So now that different parts of the country are doing different things, for right now, what you're seeing, what would be the top 3 things that you would want people to know?
One general thing is this requires a coordinated response. You can view this as a football game, if you're talking about American football, or a football match, or a basketball game, or what have you. Think about it this way. If you were to have people running in all different directions during a football match or football game, like what are the chances that you would be able to take on the opponent? I mean, maybe you'd be able to defeat the opponent, but it'd be a lot harder. So when we have like things all over the place and people aren't coordinating, et cetera, it makes things more difficult. It's the same thing with
But Bruce, I don't want to interrupt you, but that's great for the governors, the mayors, right? So, but and that's a whole different call, and maybe we can do that with them. But for individual folks, for people that are on this call, for the people that are watching, most of us are not in the position to coordinate. The only people we can coordinate is ourselves and the people in our families. So what would you recommend for us, for the people out there that are watching, for the people on this call?
So it applies individually as well, because we have to remember that everything that we do affects other people, and everything that other people do affects us. And there's a tendency to think that we're on these islands and that we control everything that we do, and that maybe we don't depend on the person that's far out of sight or in another neighborhood or another situation. But this pandemic shows that we are, for better or for worse, and I'd argue in general for better, but sometimes for worse, are intricately connected. We affect each other, what we're doing. So this applies to everything, economically, behaviorally, socially, et cetera. So when we do when we take different actions, our actions have consequences, and they affect, and you never know when those consequences will actually come back to bite you in the backside. Right
now, starting this very moment, if you could tell us what to do, and we said, all right, Bruce, we're going to listen to you. What should we do in like the next little while? What are like certain specific behaviors that you would want us to follow?
So we have to continue the social distance. And so even though things are reopening, still keep in mind the scientific principles that if people can connect with each other physically, you may spread the virus if you aren't very careful about washing your hands and disinfecting, or if you touch mutual things. So just because things are reopening does not mean return to what things were like pre-pandemic.
When we say physically distant, how far should we be staying from people?
So the recommendation has been 6 feet. Now that's a minimum. So if you can stay further, great. I mean, it's not as if there's suddenly like a wall of force that comes down at 6 feet. Every border is a gradual thing. 6 feet is an easy thing to remember. I like to say, just think of someone that's 6 feet tall and then imagine that person lying down like between you and someone else. So that's easy to remember. But there are some studies which suggest that respiratory droplets can carry further, and also gets complicated because 6 feet, maybe if someone's just breathing normally, but what happens if someone's running and panting or something of that sort? 6 feet means okay, at least 6 feet, but try to keep as much distance as possible, physical distance. So some people are suggesting, oh, it's better to do 12 feet. And it doesn't mean, oh my goodness, I was within 11 feet for a second. Cats and dogs will fall from the sky and everything will be a disaster. No, I mean, it's all relative. I would say try to keep as much distance as you can within reason, but certainly more than 6 feet.
So one is the physical distancing, 6 feet.
Mm-hmm.
One is the wearing masks, right?
Yeah, it's because again, you're protecting other people from you, and you don't know unless you're taking a test constantly and get the results immediately. You don't know when you may become infectious. Even if you had a negative test yesterday, you may become infectious today.
Hand washing, you mentioned.
Hand washing is so important. Yes, we are terrible at hand washing. There was a study in which they put like this, invisible ink on people, and had them wash hands and then had them touch their face, and then like all the ink ended up on people's faces. So we're really bad at that. So people hear about sing the birthday song or count to 20. If you don't want to sing the birthday song, there's plenty of other songs that I can offer that you can sing. In fact, if you Google it, there's like songs that I can sing other than Happy Birthday.
To wash your hands.
You'll get lots of other options. Wash your hands and do it like, back of the hands, in between the hands, do it very diligently.
That's great. And I think we're getting a lot of questions. So this has been fantastic. Let's just take people's questions now, because I think people are really wanting to ask you specific questions. Joel is asking, will we ever get back to normal? And I would say, what does normal mean? How is the future going to be? Is it changed forever?
It all depends on your definition of normal. Whenever you go through things like this, things change. If you look back in their history, whenever our country has gone through certain disasters, things never really returned to what they were before. They changed. Certainly after 9/11, airport security changed, how you fly changed. The TSA was started, all these different things. Now, that doesn't mean necessarily the future will be worse, but things will change. Now, when people ask that, I'm assuming they mean more like, okay, will we be able to interact with people, or will we be able to, get close physically? And that's going to happen. Yeah, eventually. The question is when, because throughout history there has been these infectious disease outbreaks and epidemics and pandemics, and humans have survived them and have thrived after them. So I want to put a positive spin on the pandemic, because this is actually a real opportunity to see what our underlying problems were as a society. So whenever you have a disaster, there's the negative, pessimistic side. It's like, okay, there's all these problems, and certainly, yeah, I don't want to downplay. There's been major problems. We've suffered people's deaths, people suffering. That's terrible stuff, and people losing jobs, etc. But the positive side of disasters is it forces us to say, okay, what are the problems that we need to deal with? What do we need to change? What do we need to improve? So I think there will be opportunities to improve things. And yeah, in terms of actually returning to situations where people are interacting with each other, shaking hands or fist bumping and all those things like that, that will come eventually.
You think that we'll be shaking hands again?
Well, I mean, some people will be shaking hands. There's some people have argued that shaking hands is a rather archaic thing to do. That we don't need to do that. There's all these different things that you can do instead. You can do you can do a shimmy to each other, or you can like elbow bump, or do a dance, or do the electric slide, or what have you. So maybe we can get creative with that. I mean, we aren't really wed to shaking hands.
Right, and there's lots of cultures that never shook hands. I mean,
absolutely, yeah.
There's
bowing.
There's a lot,
yep.
Yeah. So I just want to say you can unmute if you have a question, and I'm going to ask the question from Sam. Sam asks, would a homemade mask made from tightly woven cotton and layers of chiffon and or silk provide any amount of protection for the wearer?
So that's challenging, because if N95 masks, the official N95 masks has a number of different construction properties that protect you. So one is you have this very tortuous, they have these fibers which create a very tortuous route for a virus to have to travel through. So physically, the virus gets kind of caught in this. And it also creates this Brownian motion where you have very small particles that just kind of bump into the fibers and never really get through the mask. But an additional thing is these masks are carrying an electric charge. So they actually charge the masks so that it makes it tougher for particles to get through because they actually stick electrically to the fibers. So you have all those levels of defense that other materials don't have. And the problem is, okay, so you could wear like a concrete block around your face. One problem, you wouldn't be able to breathe and you pass out, right? So these N95 masks are built in a way that you can actually still breathe. It is tougher to breathe when you wear them, but it keeps things from getting in. Those other types of constructions, either they get too thick so that you can't breathe, which is a problem, or they can let things through. So that's why you actually have to use something which uses that type of construction, or at least has been tested and certified as N95.
Any thoughts you would tell us in terms of, I call it warnings and advice about maintaining health and minimizing stress, even if we're not directly affected by COVID, because it's difficult on just about everyone?
Yeah, certainly all those healthy habits that are suggested or recommended during a non-pandemic times, we have to maintain. It's very easy to not maintain a healthy diet. Exercise is a challenge, right? Because your physical activity options are more limited, especially if you're used to playing team sports or you're used to going to a gym. So those things are important. So either maintain those routines or find replacements are very important. You talk about other types of health maintenance. So other medical problems don't go away during pandemic. They don't take a vacation. They are still there. So we're still going to have to deal with chronic medical conditions. We're also going to have to deal with other infectious diseases because they're going to crop up as well. And the challenge is that many of the healthcare facilities, they are reopening now, but they've closed off the routine care. So there's been studies which have shown that childhood vaccinations have gone down during this pandemic. There's another study that showed the number of visits due to heart problems have gone down. The concern is that's not because the heart problems have gone away. It's because people just aren't going to the healthcare facilities. So try to maintain those your health in that way. Try to stay in contact with your doctor or your healthcare professionals. And then, of course, there's also that stress where you may feel cooped in, or you can't do the things that you normally will help relieve stress, like social interactions. So you want to try to replace some of those social interactions that you normally have with other types of interactions, Zoom calls, or I know it's not the same. Zoom is just not the same, but trying to replicate those as much as possible. So thinking about one of the things that this pandemic does is it forces us to boil down, like, what do we really need? So, like, when you're going to the happy hour, why did you go to the happy hour? Was it because, you really wanted to eat those fries, or was it because that was your opportunity to talk to someone else and kind of, lay your problems down on the table so that other people could listen? Well, if it's the latter, then you can find other ways to do that. So you should go through a personal inventory and say, okay, what is really actually causing my stress? What relieved it before? And not like specifically like the actual general activity, but what specifically within those things help relieve my stress. And then therefore you can try to replicate those as much as possible. The other thing is, we have to stay optimistic, because ultimately, I'm hearing some of the opposite as well. Like, people are saying that, this, society will end as we know it. No, it's not going to end as we know it. This is a serious virus, but it's not going to end society. We'll get through this. And so there are positive things to take home as well.
Thank you.
Thanks for that question, Tom. And just in terms of related to team sports, when do you think that will come back? There was a question about that, team sports, like for kids,
yep.
And adults, but particularly for kids.
Yeah, so I've actually been part of something called Project Play 2020, and now we're actually having an iteration beyond 2020. And one of the goals of that consortium, and it's included all the major sports leagues like the NBA, Major League Baseball, U.S. Olympic Committee, et cetera, was to try to increase sports participation among kids, because we also have a physical inactivity problem throughout our country and an obesity epidemic. But since the pandemic started, one of the pivots has been, how do you resume play? So, so I can mention some of the things, but like if you want to get more details, you can Google Project Play, and it was initially organized by the Aspen Institute, and they have suggestions on how to get back into play, how to do safe play. So the key thing is to, how do you resume sports while maintaining social distancing and while, disinfecting things and like equipment and any type of balls you may be using, et cetera. So they have advice in terms of how to stay fit and how you can participate in activities that are still reasonably physically distant from each other. Like, so for instance, if you play basketball, of course you can start playing by yourself. The NBA, there's something called the NBA Together initiative, which they have NBA stars on social media, and they show you different drills, like dribbling drills and things like that. So I would start with that, and then it will all depend, and this is why people are pushing testing, because you really want to know what the virus is doing around your neighborhood, around your region. So it could be, if we get a better idea of where the virus is traveling, where it's spreading, there might be certain neighborhoods in certain regions where we say, okay, the risk is lower, then potentially you can resume more and more of those sports activities, for instance. And as soon as you identify someone who might be positive, you can quickly try to isolate the person and isolate their contacts. So that's why testing is so important, because otherwise, to use a sports analogy, we're playing on the football field, but we can't see the field and we can't see the opponent.
Bruce, you have been so generous with your time tonight. Oh my goodness, this has been absolutely fabulous. Thank you so much, really. And again, thank you so much, Bruce. Thank you. And elbow and bow and everything to you.
And shimmy, right?
Yeah, the shimmy, of course, we have to get the shimmy.
Yes.
Great. Thanks again.
All right, thank you.
I hope that this series finds you healthy, well, and if you have any questions or comments or need any further information, please contact me. You can reach me at yourvoice@drsusan.nyc. yourvoice@drsusan.nyc or drsusan@drsusancares.com. drsusan@drsusancares.com. Please be safe. Please take care of you and your loved ones. And I look forward to seeing you at the next episode of Your Voice with Dr. Susan, the home edition. Thank you.
Some people commonly misperceive it that an introvert is just somebody who's solitary or who's reclusive, like Emily Dickinson, or that an extrovert has to be the uber extrovert, like Bill Clinton was an uber extrovert. Like, he not only loved the campaign trail, but reports are that when he was with people in a room, you couldn't get him out because he loved talking to everybody and he loved the energy of people. But it turns out that what we're looking for is the sweet spot of energy. And the thing is that extroverts need a lot of stimulation to feel energized. Introverts get stimulated pretty easily, and so they retreat to regenerate. And ambiverts kind of need both that external and a good deal of that internal to get their sweet spot. So again, I like to think of it also as we all need to find our sweet spot in terms of how we get energized and how we feel fulfilled. And of course, you know, introversion and extroversion are just one dimension of that, but they're pretty crucial.
So when we talk about work, or we talk about you just mentioned something really beautiful. You said that there's something that shames us, and then we don't try it again. We don't try to do something again because we say, oh my God, I did speaking, and then I went on a stage, and then there were 5,000 people, and I just made a complete fool of myself. To become a stronger consciousness vessel and be forthright with what I feel and my vulnerability without collapsing, without becoming reactive, then I can trust myself to go into a situation and be exactly who I am, no more or no less, and accept people for being exactly who they are, which is the foundation of a safe space.
In most cases, kids are pretty self-optimizing. They don't need us to tinker with every little thing about them. They typically are pretty good at pursuing what they need for development. And what is that? They need to mess around with stuff and figure it out. They need social interaction and friends, which obviously is a little challenge right now during social distancing. And they need parents that show them support and love. And when you have those basic things, kids tend to do really very well.